We have been very strategic in implementing healthcare provider training partnerships. We went to organizations and said that we have this roster of healthcare provider trainings. Do you want to embed this in your professional development training plan in your organizations? Because everybody has professional practice guidelines. We can present that, but somebody standing in front of the room and saying, you know what, I have a busy practice just as you, and I am able to use these tools and get to the end results that I have. And over time, every single person that attends the training is now using the same language around client behavior change or patient behavior change. And you're looking at a culture change as opposed to one person coming from one organization and feeling that they're alone, as opposed to a team from that same organization attending, and now there is a cluster. And that change piece is what's critical. So that's been the other strategic way in which we've done that work, subtly, so that we're not asking people to come to us.
Well, being a facilitator in this program maybe means the world to me. After all the years of doing this program, I don't get bored of actually seeing people and seeing people's eyes light up.
When I started to put it into practice with my patients, I saw a shift in what I was getting back. Utilizing open-ended questions and really listening to understand and to provide some empathy and not to push, and using myself as an intervention to help motivate change within patients, I started to see patients responding to me in a different way. And for me, I was like a light bulb was going off in terms of, wow, this actually can work. We really wanted to make sure we were offering clinicians in a hospital environment tap into community programs that are offered that are evidence-based, because it's hard for clinicians to step away from their work to learn these skills in a way that's applicable for them. You're working on it still every day because it's something that you have to keep practicing.
What's really special about the work on choices and changes is that it helps us work with staff and work with healthcare providers to understand patient needs and choices differently. Instead of having situations where people are frustrated or unable to talk about important health needs and change, this really does help that healthcare provider understand where a patient is and have different tools to ask questions. Generally, the people who attend the Choices and Changes sessions are healthcare professionals of all different types. So we could see nursing staff, we can see physiotherapists, pharmacists, occupational therapists, social workers, speech-language pathologists. We've had doctors attend, you name it, and it really is relevant to their practice. I think that this kind of dialogue and these types of tools help patients feel heard. And it helps people feel that when they go into a healthcare encounter, what they can do and what they want to do matters. As opposed to traditionally someone being told, well, you gotta do this and you gotta do this and you gotta do that. It helps someone feel that they've been able to help determine what they're doing, and that helps them buy in more. And ultimately it means that people are better able to do what they need and want to do to manage their health.
I think that this program is a labor of love for a lot of people. And there are so many stories of people benefiting from what they learned, either as people living with chronic health conditions or as healthcare providers. It's not just a feel-good story, there's also very rigid science and thought process going behind it. It's sustainable, which is exciting.